It's a common question that people have. Do I have heart disease? Is my heart in good shape? Where do you tell people to start? What should they do?
Well, heart disease is very common, particularly in middle-aged and older adults. So generally we say start with your primary care physician and have a good history and physical exam.
And for the history and physical, you'll get an indication of whether you meet some risk factors. What are some risk factors when we use that word?
Right, so some of the more common risk factors are things like high blood pressure, high cholesterol, high blood sugar or diabetes, and smoking.
So all four of those. Now, what's a normal blood pressure?
So normal blood pressure, 120/80 or lower.
And so that's the number that people ought to remember. If their blood pressure is high, I always recommend they get a blood pressure cuff at home so they can measure it, so they can help their doctor know what their blood pressure is. Cholesterol, what's a normal cholesterol?
So a normal cholesterol is certainly under 200, but really ideally it would be under 150. And then we look at the good and the bad cholesterol. So the bad cholesterol, that's the LDL, we want that to be low. And the good cholesterol, the HDL, we want that to be high.